think I can honestly say that I have done every approach to the hip there is, and I've settled on the approach that I use for what I think are a number of very good reasons. The direct anterior approach requires, in most instances, I think some people try without, but in most instances, a special table. The sole purpose of that table is to put your patient in a position where you can get your femurs and so on down the femur, okay? And in some patients, it's particularly difficult. People are using shorter stems, because you can't get a long stem in there. Shorter little curved stems to facilitate putting the stem in. And by the time you're done, the gluteus medius, which happens to be one of my favorite muscles, looks like hamburger. And that's not on either, because you've reamed it, you've retracted it, it's torn, it's damaged. I think that is the weak point of the direct anterior approach, is the femur, not the acetabulum. I will concede that the look you get at the socket is terrific. The trade-off, unfortunately, in my book, is not worth it. Not worth it. And the posterior approach that the four of us are doing, the shot at the femur is dead straight. Boom. No muscle damage, no going around corners. It's a straight shot and no table. All you do is cross the leg and you're looking down the femur. So I think that what we've evolved to is a much gentler surgical approach. Does not require huge retraction. The blood loss is less. Analgesia is less. Complications are less. I think the get up and go, as I said, my patients are leaving hospital the next day. And the biggest advantage of all of doing the surgery in the posterior approach, if, God forbid this happens, if you split the femur, if there's a problem, you simply make your posterior approach a little bigger and you aim towards doing a traditional posterior approach. Same skin incision, just a little longer, same soft tissue dissection, just a little more, and you're right there. If you get caught like that in an anterior approach, close up and go somewhere else. Now figure that. That to my mind inhibits my thought of a direct anterior approach absolutely and completely. I'm about patience. You know, I've now done something over 10,000 joints in this hospital. Sounds like a lot. It is a lot. I've spent my life here. I've done over 10,000 joints here, and I like to think we've provided a good service. And if I can improve the outcome for the patient in any way, I'm going to do that. That's what I'm here for.